So, thank you so much for joining me today for this interview. I really appreciate you taking time out of your day to do this. So, first, could you just tell me your name, your year, and your major?
I'm Shania Mahabi. I'm a third year student and I'm a double major in biomedical sciences and nursing.
My name is Lydia. I am a second year junior health science studies major.
I'm Jen, and I am a second year biology major in the 3+1 program.
Yeah, so I'm Zach Saracino. I am a third year biochem major in the 3+1 MCB program.
The COVID-19 pandemic was officially declared by the World Health Organization in March of 2020, leading to social distancing and traveling restrictions. So it's been 2 years since the start of the pandemic, and we're still in the midst of it. The purpose of this interview is to ask about how the pandemic has affected your everyday life. So occupations are everyday activities that people do as individuals and families with communities to occupy time and to bring meaning and purpose to life. So occupations include things that people need to do, want to do, and are expected to do. To start this off, have you ever had COVID-19 before?
Yes, I have had COVID. I got it this year, so it was more when the pandemic was like kind of dying down.
I did once last year, the winter of, I guess, 2021.
Yes, I have.
Yes, I have.
How has the COVID-19 pandemic or physically having COVID impacted your activities of daily living? So this can include basic physical needs such as hygiene, grooming, dressing, toileting, eating, etc.
So I feel like in general, my basic needs like hygiene, grooming, dressing, it wasn't really inhibited because I was at home when the pandemic first started, and even throughout it, like either at home or school, everything was basically met. But I would say that when the pandemic first started, I am like a big foodie. So like I like to go out to like different restaurants and eat. And a lot of times with my hometown friends, we like to go out and like eat and get new food. So when we were all sent home, and it was a little rough because we couldn't go to restaurants. And then once things were starting to open up, a lot of restaurants were limited where you couldn't eat there or you had to like dine out. So I feel like in that aspect of like more of like what I like to eat, it was uninhibited, but I still was able to like obviously eat food at home and still like to grocery shop and stuff like that.
I think in terms of like my activities of daily living, so the basic things, it really hasn't affected it that much because I've been able to do my hygiene, been able to do all of my ADLs. So it's not really that too impactful there. I guess it didn't really impact my ADLs that much from my experience.
Hygiene, still able to keep up with that, obviously, and have my own like shower, since we have 2 showers in my house, but brush my teeth and stuff like that.
How has the COVID-19 pandemic or having COVID impacted your instrumental activities of daily living? So these are activities that allow you to live independently in your community, such as shopping for groceries, managing money or paying your bills, getting around by car or public transportation, etc.
Most of those things I'm still able to do. Like I was still able to do while I was like had COVID. Maybe the public transportation was altered just because of the fact that there wasn't really that much of I couldn't really leave obviously because I had to quarantine. So a lot of times it's just kind of a restriction of using public transportation or something like that due to being contagious.
COVID affected a lot of things, but it affected that too. I think for like the first, even like a year or so, probably was over a year. My dad was doing all the grocery shopping. Prior to that, I would go, either by myself or with like my sister. We would go get groceries for our parents, but my mom was worried about that, so she wanted us to stay home. So I felt bad. My dad always went out and did the grocery shopping and by himself. So definitely affected that. And transportation, I would say, was essentially the same because I could drive by myself. So. But my parents were also worried about me having people in my car, and so I couldn't really give people rides that I normally might give. So it affected transportation too.
It was hard to get things in stores. Like the stores were really packed, and then also when we did get groceries, we had to like clean them and make everything like more like hygienic or whatever. So that was kind of frustrated when like the time we had to spend in order just to get like the little like not as much groceries, and then like waiting in line, then actually getting food and then cleaning it. That was like very time consuming.
How has the COVID-19 pandemic or physically having COVID impacted your rest and sleep?
So I feel like it kind of made my sleep like worse because especially when we couldn't really go anywhere, like I wasn't as active, especially like having Zoom and always sitting down at a desk. Like I feel like my mind was constantly just like on a screen, like on the go. So when I actually wanted to sleep, like my brain was tired, but my body wasn't because you weren't really walking around like the things I was used to, like walking across campus or like walking to get food and stuff. Like I didn't do that at home. Like it literally was just in my room, like doing homework all day and like that was it. So I feel like because of that, it made it harder for me to like fall asleep. And then also like the stress of just like living through a pandemic, like even like just the beginning to like the end of it, of just like being on like Zoom university and like a lot more independent work, and the fact of being a student and having to do most of the work on your own and like self-learn, that was like a lot of stress and anxiety. So that also like impacted my sleep.
Well, actually, it improved my rest and sleep because I didn't have to wake up as early for school. So I kind of set a routine for myself. I like did homework for most of the day, and then I would exercise, and then I would like be in bed by like 10 p.m. and I would wake up at like 7 a.m. every day. So that in that aspect, like I guess it kind of benefited me not having to wake up as early, so I had the free time to rest and catch up on sleep from high school.
I think I can answer in this in twofold. Like physically having COVID, obviously I had the mild symptoms of it, but it did impact kind of how I was able to kind of have, I would say, like good rest. So it wasn't really comfortable. It was kind of just, when you're sick, you don't have the opportunity to really have like a nice, well rested night. So it kind of left me fatigue throughout the day because I wasn't able to sleep properly. And then like in the whole, like there's a lot of things that happen that go on in your mind during the day with like pandemic and how that kind of changes a lot of the things that were set in motion. Now they're changing and morphing into something new because of COVID-19. And so that kind of also leads to some like insomnia at night and not, you're kind of disturbed from your rest and you're still fatigued in the day because of that.
How has the COVID-19 pandemic or physically having COVID impacted your education?
As we know, for science majors, a lot of our work is done in the labs and also getting like clinical experience. So that was totally like shut down. I couldn't get the lab experience that I really should have gotten as an undergrad. And also like being able to work in the hospital, like that was totally thrown out the window for a while. Even now, when I had COVID, I wasn't able to volunteer in the hospital for like a month or over a month. So it definitely affected education and like experience, especially with education.
I transitioned into college, which was more difficult because it was like a completely new environment, like new school, and like pretty much knew everything. And adding COVID on top of that made everything a lot harder than it should have been because all the online classes, I feel like I'm not learning as much from online classes because I don't because there are so many distractions when you're in your own room that I feel like I easily get distracted by something like my phone or something, and I don't want to, but like since it's there and no one's watching, I feel like I just tend to play with things. Whereas like if I'm in the classroom, it would help me learn more and retain the information more because I'm like, I don't want to say this, but like forced to pay attention basically.
My education also, my first year of university was online most of the time, right? And so it was a lot of socially distanced, a lot of mask wearing, and not opportunities to kind of like be in class. So it kind of impacted it in the way that I had to adjust to that online model, as well as adapt to kind of working and understanding that I have to frame my room in the right way. So I'm working at my desk only and not in my bed or something. So I don't mix my work and like sleep in areas together. So that kind of impacted education just by I had to kind of change how I did things that typically I didn't have to really think about because I go to school to like, to go to do my work and everything. But now I was I was on my computer the whole time. So it turns out that, I have to kind of adjust how I did that.
How has the COVID-19 pandemic or physically having COVID impacted your work?
It was basically like you couldn't work because my parents and myself included like weren't comfortable with working around the virus. Obviously, like eventually you had to go back, no matter um, no matter the circumstances, because like you reach a point in like financial status where you just can't afford to not work anymore. So yeah.
So I used to work in the mail like service center. So before the pandemic, the mailing ICE work was in the student center, but then after the pandemic, they had to move it because of like the space and like having to fit amount of students in a certain area, like it wasn't following COVID guidelines. So they had to move it, which was like all the way across campus. And I know that a lot of students were complaining about having to walk so far. But when I worked there, I had to like walk that far and I had to adapt to like a completely new system of like organizing mail and having to stay in that facilities. Like it was very grim and like dark because in the student center, like it's lively, but in the mail services, like working on the back end, it's literally just like a garage. Like it's very, very like sad. So I eventually stopped working there because like the environment for me just wasn't healthy. But it was just again like the lack of motivation, and it's just like it seemed like the world was just really grim, and it was really hard to try to stay active in things that like made me happy because there were so many, we were so limited on the things that could make us happy.
I guess it kind of affected it. So like at school, I'm a peer fellow and a study table mentor. So like we used to do all those in person, and so like it's very weird, like doing them on Zoom now. It just feels different. And then also doing like going to class physically as like a peer fellow, like that was also online. So it definitely felt different. So it did affect that, I would say. And once again, it's not the same experience like teaching people in person versus like online. You have to get a little more creative.
How has the COVID-19 pandemic or physically having COVID impacted your play?
I would say that it definitely affected it. For example, like in the summer of COVID, I usually played a lot of like basketball with my friends, like in high school and stuff like that. And we'd go out, like go to the beach and do things like that. So that was all like limited because we were all trying to be cautious. We didn't know much about COVID, and our parents were concerned. So we weren't really able to go out and do that. I resorted to playing a lot of video games, and like, that eventually let me get a Switch and everything. So yeah, not the same. I mean, of course, we would play like video games together, but like it's just not the same as doing the normal activities we would also do.
I would say that a lot of it was kind of individual play, like maybe at home doing like video games or something like that. That wasn't too impacted because I was by myself, an individual, and I can still, through means of internet, I can still like kind of connect with friends over like online and obviously, right? And but like being in person with other people, maybe going to like a like David Buster's or like an Alley Cats or like some kind of like gaming, like a putt kind of area, right? You can't really do that anymore. You can't really go and hang out with your friends in that little area, and be able to kind of just interact and have fun doing that. So I feel like the social distance part of that was kind of more restrictive. Um, but overall, I think the social distance part was good, just to get in terms of like keeping people safe. But like just in terms of play, it was more restrictive, obviously.
I couldn't hang out with my friends as much. I couldn't really do a lot of things that I like to do, like going to escape rooms and like going to the amusement park, because those are all like public places that like could potentially spread germs.
How has the COVID-19 pandemic or physically having COVID impacted your leisure?
So I would say that because of like Zoom, like since I had to say we had to like study a lot on our own and do a lot of self-learning, I feel like leisure time was spent more of like doing learning. So I feel like professors were like, oh, well, you have more time, like you're not going to class, like I feel like we got more work. So I feel like my leisure time was like decreased, and the aspect of what I did during my leisure time was just very, very different than like what I did prior to the university. Like there weren't as many events last year, like events were online. So like my leisure time was again just in the same space of like being on my laptop, joining a club, joining a program online. So in that aspect, I just feel like my leisure time was shorter and not as like positive.
Honestly, I think this is one that was kind of positive because I had time to focus on self-care and focus on, you know, taking care of myself and having these leisure activities. Oh, you wanted to learn how to cook this or do this, and those activities were kind of just fun to do. And have I had more leisure time because I was at home more than being in like going other places because typically before the pandemic, I didn't really have that much time. And, afterwards, I had more time to explore different leisure activities. So I feel like that was a positive and plus for me.
I did find new hobbies because I started exercising every day during quarantine, like in my room. Instead of going to the gym, like I was just in my room using a yoga mat, like exercising. And like like from that, like I found a way to use the free time efficiently, basically.
How has the COVID-19 pandemic or physically having COVID impacted your social participation?
Kind of not being able to kind of be with your friends and maybe go to the movies or something like that. That was limited, obviously, due to like quarantine and social distancing and kind of isolation, right? But I do think that so it also pushed us to kind of learn how to reach and connect in other ways. Like I know I couldn't really see my family because we're living in different parts of like the country, right? And so we utilize tour family connections. And so we have like monthly Zoom meetings that we utilize. So things like that have been an advantage, like a plus, because we've learned to connect, even though there are barriers. We've learned to have that to still build those bridges. So I feel like that was a plus in my social participation.
It was definitely more use of technology like FaceTime and like video calls to like talk to everyone, like texting and all the social media like or social apps, like instead of face-to-face interactions. It was a lot more of like on my phone doing everything.
So last year I was an RA in freshman housing. So like I was a sophomore living with freshmen and all my friends like lived in sophomore housing. So in terms of like actually having social interactions, like I couldn't do that because we couldn't go into each other's dorms. Like the only time we could see each other is if we got a meal together in the caf or if I walked, like we just walked on campus together or outside. So because of that, I spent like a lot of time like alone or just again like trying to like talk on the phone with my friends or like FaceTime or something because everything literally had to be in a public setting if I wanted to see people that were like the same age group as me. So that was really, really tough. And especially because like public places, like not even just restaurants, like activities like movie theaters or like even like roller skating rinks, like things that people would do for fun, like they were all closed. So we literally were very limited to just the outdoors. And since we live in the Northeast, like we only were able to go outside for a little bit until it got really, really cold. So the social interaction was really, really missed.
Well, thank you so much for participating in this interview with me. Like all of your answers are really insightful and will definitely help to see how the COVID-19 pandemic has impacted like students and just like people in general. So again, thank you so much for your time.